Okay, so it is 12 o'clock and we will go ahead and get started. Thank you all so much for joining me today. My name is Abby Luce and I work with GatorCare Wellness. And today we're going to be talking about some sleep habits and how to get better quality and quantity sleep. And so this presentation is called Peaceful Zzzs. And we're going to talk about how important sleep is and just how to get good quality sleep. So with that being said, we have our agenda here for the day. So we are first going to identify our own personal habits and our feelings about sleep. So we'll do a little bit of self-awareness and self-reflection about our own sleep habits. And then of course, we will learn some healthy habits and how to get the best quality sleep. We will also learn a little bit about sleep disorders and some of the very common ones that we see in the United States. And then we will also talk about setting up a sleep journal and answering any questions you all might have. So before we dive into this topic, a few housekeeping items. If you do have any questions, feel free to drop them in the chat and then we will get to them at the end of the presentation. There'll also be some time for interaction within the chat or reactions through the Zoom reaction function. So keep that in mind. Feel free to interact in the chat or using those reactions through Zoom as we move through. Okay, so I want you to start thinking about your own current behaviors when it comes to sleep and thinking about how many hours of sleep you get in 24 hours, but also how is the quality of that sleep that you do get? So if you are getting enough sleep, are you feeling rested? Are you waking up and feeling like you're ready to tackle the day? You have a good feeling of restfulness? Or do you wake up and still feel fairly sleepy or crash in the afternoon? Or do you find it hard to fall asleep at night? So I want you guys to just take a moment here and think about your own personal behaviors, how many hours you get, and if there's any difficulties that come to mind when you think of sleeping. And this is just a personal reflection, but if you want to drop in the chat any experiences that you have, whether that be just even with the daylight savings time happening this past weekend, if your sleep routine has been impacted and you're feeling a different level of wakeness or sleepiness currently. So we'll just take a minute here to think about those things. And then also consider your bedtime routine as well. I want you to think about what sort of things you're doing right before you go to bed. Do you find that you have a routine that you keep up with day after day, or maybe not? How consistent does that look? So maybe some people struggling with waking up in the middle of the night, for sure. So if you do find that you are having issues with sleep, maybe that is falling asleep, staying asleep, or maybe just not getting enough sleep every night, you are definitely not alone. About half of all Americans actually report feeling sleepy during the day 3 to 7 times a week. And so this is a huge issue that we experience in our society today. And of course, we are going to talk about some practical habits and behaviors to hopefully help overcome some of the issues that we see day to day. And then sorry, we're going to pause for just a second because I see my screen stopped sharing. So let me reshare real quick. Apologize for that. Okay. So yeah, this is a big problem in the United States today. And so we're going to talk about some practical behaviors about how to get the best quality and quantity sleep moving forward. And before we do that, of course, we need to talk about the importance of sleep. I'm sure it comes as no surprise to most of you that sleep is absolutely crucial and it's very important for our bodies, our brains, and overall health and well-being. I'm sure all of us have experienced maybe one night or maybe consecutive nights of interrupted sleep, and we wake up feeling groggy, we have less creativity, less motivation, we tend to make worse behavior decisions when it comes to our behaviors. And so this is just, maybe you've acknowledged this in your own life, and this is one way that you kind of see how important sleep is in your own body. Of course, physically, sleep helps reboot our body. It helps keep our tissues and our muscles repairing. It helps us stay healthy mentally. It improves our immune system, restores our energy, also improves our memory function. So you might see this too if you lacked sleep over the course of a few days. Your memory definitely starts to be hindered by that lack of sleep. And of course, over time, if we are chronically not getting enough sleep, this can lead to some other bigger issues as well. So it can lead to depression, anxiety, alcohol use, obesity, and chronic diseases. Like I mentioned before, if we don't have enough sleep, a lot of times our behavior making and decision making is impacted. And so we tend to maybe reach for more junk food or food that doesn't necessarily fuel our bodies. And we lack energy to exercise and move. And so this over time can increase the incident rate of chronic diseases like cardiovascular diseases, overweight, and obesity. Not only, obviously, with chronic lack of sleep, there's these large issues that can happen, but also if we just miss one night's sleep. So 24 hours of wakefulness is actually equivalent to the cognitive impairment that we feel with a blood alcohol concentration of 0.1%. And that's above the legal limit to drive in Florida, which is 0.08%. So we see that sleep not only is important for our own physical and mental health, but it can also contribute to safety concerns as well. If we're on the road and we do not have, we didn't have restful sleep overnight or no sleep at all, it can actually impact our ability to make quick decisions and can increase the risk of accidents on the road. Additionally, when we think about medical errors, in a year, there's about 100,000 deaths attributed to medical errors due to sleep deprivation. So again, we see how important sleep is to properly function, and we need to stop thinking of it as a luxury and really start to prioritize it because it is so important. It truly is critical to our overall health and well-being. So this begs the question, how much sleep do we actually need? And this is a little tricky because everyone is different. However, there are some recommendations from the CDC and from the Sleep Foundation. Everyone agrees that adults over the age of 18 years old need at least 7 hours of sleep a night, sometimes even more. And this does not include napping. You'll see on this graph here, until we reach the age of 5, the total cumulative hours of sleep do include naps. But as we get a little older, we don't include those naps anymore because as we move through, we're going to talk about some of the sleep cycles and how that impacts our sleep. But as we get older, it's very important that we have consecutive sleep for at least 7 hours at night. So I want to ask you all here, now knowing that as adults, we need at least 7 hours of sleep per night, do you get enough sleep on average? Feel free to share that in the chat if you feel comfortable. If not, just again, a self-reflection question for you. Yeah, so lots of chats coming through. Definitely not. Sleep's been a big problem. Yeah, getting enough sleep, and definitely not during the work week. Yeah, and we're going to talk about some of those reasons why typically we don't get enough sleep. And so one of those big reasons is our lifestyle and our occupation. You guys were mentioning it in the chat that not during the work week we don't get enough sleep. And that tends to be a common problem for a lot of US adults. A lot of things happen in our days. We have responsibilities that have to be tended to. And sometimes we feel this, this paradox, or maybe we feel like we don't have enough hours within the day to do everything we want. And so trying to fit everything in and get enough sleep can sometimes feel very, very hard to do. So of course, those responsibilities, those occupational demands, social demands, recreational demands, all of that stuff plays an impact on our total hours in the day that we have to use. But I will say another really contributing factor to sleep loss is watching TV or even doom scrolling on social media. We see that the TV and the phone can really hook us in, and maybe we lose track of time and all of a sudden hours have gone by and we've been just on our phones or watching TV. And this, first of all, can cut into our sleep time, but also the exposure to the blue light from those devices can affect our circadian rhythm and make it harder to go to sleep because we're working against our natural clock. And we're going to talk a little bit more in depth about that in the future. Something else people have reported having issues with that contribute to sleep loss would be irregular sleep hours due to shift work or maybe even traveling. So with those things, especially when we talk about jet lag, if we are moving to a different time zone and our sleep is automatically going to be a little thrown off just with the travel and everything, the goal with this is to, as quickly as possible, adjust yourself to the new environment's clock. So when you are traveling, try to stay awake until the nighttime where you're traveling to, and then wake up in the morning at a typical time. And then when we talk about sleep disorders on the other side here, this is another impactful piece that we have to consider when we talk about sleep loss. Of course, our day-to-day activities can impact our sleep, but also if chronically we're experiencing sleep loss, we might want to consider that we have a sleep disorder. And we're going to talk about some of the common ones later in this presentation. But sleep disorders are very common. About 50 to 70 million Americans reported that they suffer from one or more sleep disorders. And that's probably a low number because not everyone is diagnosed with a sleep disorder and maybe just suffer from sleep loss without actually knowing why. So we're going to talk about some of the common ones like insomnia, sleep disordered breathing like sleep apnea, restless leg syndrome, narcolepsy, and so on and so forth. But before we get into that, I think it's really important that we understand what some of this terminology we're going to be talking about is. So you probably have heard the term circadian rhythm, but what does that actually mean? So our circadian rhythm is our body's internal clock system that helps us regulate certain biological processes in our body. So our circadian rhythm, it functions and responds to light and dark. So that could be the rising and setting of the sun, or it could be impacted by fluorescent light or light coming from a TV screen or a phone screen. And so this can be why it's so disorienting to travel throughout the night or to work a night shift job, because our body's internal clock that influences our hormone releases, our eating habits, our body temperature, our blood pressure, all of those things happening in our body is influenced by the exposure to light and dark. And so when we think about this as a person who doesn't work a night shift or is traveling throughout the night, and we think just day to day, our internal clock is most sensitive to light about 2 hours before our normal bedtime throughout the night, and then until an hour after we normally wake up. So when we think about this, if we are having a really hard time in the morning waking up, we feel so groggy when we wake up, something that could help us acutely is exposing ourselves to sunlight or some other artificial light as well to help expose our bodies to this light and then influence the hormone releases to help wake us up. And then conversely, if we're having trouble sleeping or falling asleep at night, we want to make sure that we're in a dim lit room or that there's no extremely bright lights right in our face. And so that leads us into talking about the 4 stages of sleep. And so in overall sleep cycles, we will go too in depth about this, but I think it is really important to know that we have these 4 different sleep cycles, and all of them are important for different reasons. And so we start in stage 1, which is this non-rapid eye movement sleep. And this is pretty short. It's 1 to 5 minutes long, and it's kind of that dozing off stage. So we start to see some brief muscle twitches, but it's still very easy to wake someone up in stage 1. And then as we progress, we move into stage 2 or into sleep. And this is a little bit longer than in one sleep. We start to see our brain activity slow down, but there's still short bursts of activity. And so this is helping us resist being woken up, but we are still fairly easy to wake up in this stage. Then we quickly move into stage 3 or in 3 sleep, and this is deep sleep. This is really deep restorative sleep. Our muscle tone is effective, our pulse slows down, our breathing rate decreases, and we relax into this deep sleep. And this stage is believed to be the most critical because it allows our body to deeply recover and improves our immune system and may even contribute to creativity, insightful thinking, and memory. So very important that we get this deep sleep. And then we start to move into REM sleep, which is rapid eye movement sleep. And this is when our brain activity picks up, but our muscles in our bodies are actually temporarily paralyzed, except for our eyes. And that's why it's called rapid eye movement in this stage. We see that only the muscles in our eyes and then that are in charge of our breathing are working in this stage. And our REM sleep gets a little bit longer as we move through these cycles throughout the night. So these 4 stages create one cycle of sleep. We move through all 4 of these stages in about 90 to 120 minutes. And so when we think about waking up in the morning, if we are being woken up by an alarm as we're going through stage 3 in this deep restorative sleep, we tend to wake up feeling more groggy because we didn't finish out this entire cycle of sleep. And so what I think is a very practical tool to help us kind of gauge and figure out when we should be waking up or when we should be going to sleep at night. There's lots of online sleep calculators that you can type in either your bedtime or when you want to wake up, and it'll give you an estimate on when you should either go to bed or wake up. And it'll use the sleep cycle that happens every 90 to 120 minutes to kind of estimate that for you. And so it's estimated that we need at least 4 to 6 of these complete cycles every night to feel effective, to feel restful, and to get the best quality sleep. All right. So how do we do that? Of course, our day-to-day activities, what we're doing throughout the day, affects how we're sleeping at night. And so we're going to talk about some of these healthy habits to consider implementing within your life. And as we go through them, I just want you to think about whether or not you're already doing these things and how that has impacted your sleep quality overall. So the first tip here is reserving the bed for sleep and intimacy only. What's really important, what we see through a lot of studies, is that creating this connection between our bed and our bedroom to sleep is very important. We need to keep this association between sleep. And so if we are watching TV in bed, we're working in bed, we're eating, whatever else in the bedroom, we're breaking that association our brain has, the kind of the tie between sleep and the bedroom. So very important to try to avoid doing activities outside of sleeping in the bedroom. Also, keeping a regular sleep routine is very important. So having a consistent sleep and wake time can help regulate our circadian rhythm and just overall go through those 4 to 6 cycles of sleep every night consistently, which can help lead to feeling very restful over time. And when we talk about actually winding down for the night, keeping a regular sleep ritual can help as well get our brains and our bodies in the mindset of going to bed. So it can help us avoid laying in bed and not being able to go to sleep. Another tip with that, if you find that your brain is racing at night, writing down some of those nagging worries or those to-do items that you feel like you keep ruminating on right before bedtime can help kind of put those away. You can write them down and then stop worrying about them in your head. Some other things here too, when we talk about our environment, we want to make sure obviously we have a comfortable bed, having the sheets and mattress and pillows and things that are comfortable to you. Keeping the room temperature between 60 to 75 degrees is what has been found to be best to help us get the best sleep. And then throughout the day, we want to make sure that we are avoiding certain stimulants right before bedtime. So avoiding nicotine 30 to 45 minutes before we go to bed. And then avoiding caffeine 4 to 6 hours before bedtime. This is a stimulant that lasts in our bloodstream for 4 to 6 hours after we consume it. So instead of reaching for that second cup of afternoon coffee, instead maybe opt for a decaffeinated tea or some fruit that has sugar content that kind of gives you some of that energy boost without the negative side effects of caffeine from the coffee. Additionally, avoiding alcohol or any heavy fat meals before bedtime. Our body, as we sleep, again, we tend to turn off the muscles in our body that aren't needed for our sleep. And so if we're trying to process and digest food throughout the bed, our entire sleep time, it's impacting our quality of sleep. And then similarly, if we're drinking a lot of water right before bedtime, we might have to wake up in the middle of the night to go to the bathroom. And so trying to stay hydrated throughout the day is very important instead of trying to get all your water intake in right before bedtime. And these last 2 points here, so avoiding late afternoon naps, this can impact how easily we fall asleep. And if we do find ourselves laying in bed and we can't fall asleep, we're just having a really hard time with it. Something that's recommended is that you get out of bed after 20 minutes or so of not being able to sleep, again, to try to reserve that association between sleep and your bed. And so if you're having trouble and you're laying there for longer than 20 minutes, just try to get out of bed, maybe move to a different dimly lit room and do some sort of boring activity, whether that be meditating, deep breathing, folding laundry, or something, again, that doesn't require too much light, because that can, again, impact our circadian rhythm. So we want to just try to reduce our exposure to light, try not to turn on the TV or go onto your phone, because that's just going to make it a lot harder to go back to sleep. And then one other thing I want to mention here is getting sunlight throughout the day. In Florida, it's not as hard to do this, which is great. But sometimes during the winter months and we're inside a lot of the time, if we're not getting at least 30 minutes of sunlight a day, that can actually impact our sleep as well. So when we're getting at least 30 minutes of sunlight a day, this actually increases the hormone called serotonin in our body, which is a precursor to melatonin. And melatonin is the hormone in our body that helps us respond to darkness and relax and eventually fall asleep at night. And so if we're getting natural sunlight throughout the day, we're getting some serotonin. Whatever serotonin's left in our bloodstream at night and when the sun goes down, that actually turns into melatonin and helps us sleep better. So important to get at least 30 minutes of sunlight a day. So now that we have talked through some of those key elements or different suggestions to help with our sleep quality and quantity, I also want to mention the idea of, or kind of go a little bit more in depth about setting a sleep ritual. We breezed over that in the last slide. So what do I mean by setting a sleep ritual? Well, research has found that setting a wind down ritual at least 30 minutes before bedtime can help us kind of trick our brains and our bodies into going to bed and sleeping better. And so one of those things to do within this wind down period of 30 minutes before bedtime, disconnecting from devices. Again, we talked about the light that's produced, but then also how time can very quickly escape us if we get caught doom scrolling or watching one next episode on TV. lowering the lights and lowering the temperature in the bedroom, so setting the physical environment to be conducive for sleep. Some people like to try meditation or even a progressive muscle relaxation breathing exercise, controlled breathing like box breathing exercises, or even something else like reading that can help us relax, or coloring's great as well. And so really just creating this quiet environment, focusing on our attention and our attitude towards sleep, and having this comfortable physical position within our bed and bedroom is very important. Something else that some people find helpful is to wear an eye mask to help block out any extra light that might be coming from outside of your bedroom. And then also blocking out extra noise with earplugs, or having some sort of background white noise that can help us fall asleep as well. So I'm going to pause here for a second and ask you, do you guys have any sleep rituals that you like to do that helps you fall asleep? Again, this is optional, but something that maybe helps other people who are on this call today. I see someone said lying on the kitchen floor, anywhere uncomfortable, and then moving back to bed. That is very interesting. I like that idea. Using the Calm app, absolutely something that has a meditation you can follow along with, or a breathing exercise. Eye masks, sleep stories. Yeah, these are great ideas. So yeah, all of these things, if you can incorporate them into a ritual, it can help create that association between sleep and your bedroom. Okay, so what happens inevitably, maybe we've tried all of these different things. We've tried laying on the kitchen floor, we've tried going onto the Calm app, doing a meditation, we've gotten up and maybe folded some laundry in a different room, or did something uninteresting and it's still not working. Another thing to keep in mind would be to stop watching the clock. I know this one can be really hard for some people. Especially if you're not used to waking up in the middle of the night and this is kind of a one-off thing for you, it can feel very disorienting and frustrating. So try to remain positive and, do those tasks, uninteresting tasks. Try not to expose yourself to any bright lights and stop watching the clock. If you do find yourself laying in bed, again, for longer than 15 to 20 minutes, go ahead and remove yourself from the bed and from the bedroom so that you're not breaking that association to sleep. All right, and another tip as well I want to mention, if you find yourself having a hard time with your sleep quality or quantity, another recommendation for you would be to keep a sleep journal. And I'm actually going to drop in the chat here. We have a fillable sleep journal. Sorry, I'm having some tech problems. There we go. So we have a fillable sleep journal I'm going to drop in the chat here. And this is something that you can use to keep track of those daily activities that may be impacting your sleep. And then also how long you were sleeping and how restful you're feeling when you do wake up. So the purpose of the sleep journal is just to make you aware of your daily behaviors that may be affecting your sleep. And it's important to occasionally check in with the journal as well to assess the quality and quantity of sleep and the factors that are affecting your sleep. Something really great with this too, if you find that you're consistently struggling getting enough sleep or wake up feeling unrestful, this is something that a physician is probably going to ask you to do before you do anything else. So already having a resource and keeping track of these things can also help better prepare you if you decide to take a clinical approach and go see a physician about any sleep problems. And so you'll see on that sleep journal, there's opportunity to record your sleep-related information, like when you fall asleep, how long you're sleeping, did you wake up in the middle of the night, but also those daytime factors like alcohol consumption, caffeine, nicotine, did you have any naps that you took during the day, or are you feeling excessive stress from work or anything like that? And another important factor to keep in mind too is medications. There are certain medications that may impact your sleep as well. So taking that into consideration and jotting that down in the journal can be really helpful as well. So moving on, I mentioned earlier, many Americans suffer from one or more sleep disorders. About 70 to 80 million Americans suffer or report suffering from a sleep disorder now in today's society. And I'm sure that number has even, or is in higher than that, because again, some people don't know they have a sleep disorder and aren't diagnosed with it. So if you have tried all of these different daytime behaviors and you've kept a good sleep ritual, you're keeping a consistent sleep and wake time, you have, cut down your caffeine intake, and all of those things are still not helping, it is important to consider that something else might be going on. And so some common sleep disorders that Americans suffer from right now are insomnia, which is trouble falling asleep, staying asleep, waking up too early. Sleep apnea, which is pauses in breathing during sleep. This might not cause you to wake up in the middle of the night, but if you're consistently waking up not feeling like you got a good night's sleep, this could be attributed to sleep apnea. Restless leg syndrome. So this is a nervous system problem, and it causes you to feel very uncomfortable in your legs and parts of your body and makes it hard to sleep. It typically happens at night. And then narcolepsy, which is also another nervous system problem, and it causes extreme sleepiness and attacks of daytime sleep. And so we're going to talk about these a little bit more in depth, just because I think it's important to notice some of the symptoms, maybe causes, and then treatment as well if you feel like you identify with any of these sleep disorders. So starting off with insomnia, everyone probably has acute bouts of insomnia. Maybe there's a day or two where we have trouble falling asleep, or we wake up not feeling refreshed, and that's totally normal. What we're talking about here is when it becomes a chronic problem, where you consistently are having trouble falling asleep or waking up several times during sleep and feeling tired throughout the day. And so if you suffer from insomnia, there's multiple factors or maybe causes that are contributing to this. One of those things would be going to bed at a different time each night. Maybe daytime napping's impacting that, a poor sleep environment, certain medications, and then lots of other, there's quite a few causes that can go into this, like pain, stress, and again, our intake of caffeine, alcohol, and other drugs. So lots of different causes that sometimes can be hard to pinpoint, which is why I always suggest the sleep journal if you find yourself relating to some of these symptoms. And then if you do find that none of those behavior changes are making a difference, really important to seek maybe some clinical help. There are treatments out there that a provider can help with as well. And they might start with some sort of sleep study or, again, tracking through a sleep journal. But there's different medications that can help with insomnia as well. So I definitely recommend consulting a doctor if this becomes a chronic problem for you. Next, talking about sleep disordered breathing. So there's actually a couple different types of sleep apnea, which have different causes and different treatments. But broadly speaking, sleep apnea is basically when there are pauses in breathing during sleep. And so one type of sleep apnea is obstructive sleep apnea, and another type is central sleep apnea. And both have similar symptoms like chronic fatigue, daytime sleepiness, very loud snoring or long periods of silence while breathing stops throughout the night, and even the snorting and gasping sounds as well once you start breathing again. So those can be some of the symptoms for both sleep apnea types. One, though, obstructive sleep apnea is when your muscles become relaxed during sleep, and that includes your throat muscles. And so that's why we see some of the pausing of breathing with obstructive sleep apnea. Some of the things that can contribute to that would be being overweight or obese, and then certain medications as well. And then when we talk about central sleep apnea, This is actually when your brain stops sending signals to the muscles that control your breathing. So a little different. It's more of a physiological or neurological problem than it is a physical problem. And so some of those causes could be some brainstem problems or issues, severe obesity, and then certain medications as well. So it's very important to, again, consult a physician if you find you're experiencing any of these symptoms. And then some treatments can involve, of course, behavior changes first and losing excessive weight, but also having a CPAP device or even surgical options as well. So very important to, again, consult a physician if you find that you're experiencing any of these symptoms. Oh, sorry, the keyboard stuck here. The next one we're going to talk about is restless leg syndrome. And this is a nervous system problem that causes you to feel the unstoppable urge to get up, move around, and pace. And so it may feel very uncomfortable. There may be a variety of different feelings or sensations that you have with restless leg syndrome, but one can be the creeping and crawling feeling down your leg or burning, pulling, tugging, bubbling, things like that, or throbbing pain. And no one actually knows the exact cause of restless leg syndrome. It's linked to some other medical conditions like chronic kidney disease, diabetes, and certain mineral deficiencies. But overall, we don't have a specific cause known right now with restless leg syndrome. And so, again, important to talk to a physician and make some of those lifestyle changes like we talked about. So decreasing caffeine seems to be one that can help make those symptoms a little bit better, more manageable. And then just, again, keeping a consistent sleep and wake time as well. And the last sleep disorder we're going to talk about briefly is narcolepsy. This is a nervous system problem that causes extreme sleepiness and attacks of daytime sleepiness. So this is not that afternoon crash, maybe after you've eaten too many carbohydrates. This is truly something you can't control. This is a strong urge to fall asleep, and then you do fall asleep. It's not something that you can control through your own behaviors and things like that. And these attacks can last from a few seconds to a few minutes. It can happen while you're eating or doing something else, talking to someone, or even other more dangerous situations like when you're driving or doing other activities. And so this also may be coupled with your muscles being temporarily paralyzed. And again, can be a very scary or frustrating situation. So trying some of those lifestyle changes to help overall get better quality and quantity sleep is kind of the first level of treatment, but then there are medications that can help with this as well. So all of these sleep disorders are the most common ones. There are over 80 sleep disorders, and so we don't have time today to go through all of them. The overall main message is just if you experience chronic symptoms of any of these sleep disorders, consult a physician, go to your primary care physician, just let them know what's going on. And then there's definitely other treatments and testing that can be done to help with this. Because very important, as we mentioned, sleep is not a luxury, it really is critical to our overall health and well-being. And so wrapping up here, again, I will mention it again, sleep's not a luxury, it truly is a necessity. I like to repeat this point over and over throughout this presentation because oftentimes other things get in the way. Sleep tends to be pushed back. It's like, oh, I might be tired tomorrow, and that's fine, I'll deal with it. But truly, when we are neglecting our sleep and not getting enough sleep consistently, it can directly negatively impact our physical and emotional and mental well-being. And so it really should be a priority, and trying to make some of these lifestyle behavior changes to combat some of the, the sleep loss is very important. And then sleep quality and quantity obviously is directly affected by our behaviors like we talked about, but there are also some physiological conditions that can cause poor sleep quality or sleep loss. And so important to consult a physician if you find chronic problems with this, because sleep disorders are very important. And then again, just bringing up the idea of using those sleep strategies and tips, and consider keeping a sleep journal as well. Sleep journals, again, can help you track some of those factors that may be impacting your sleep, and then get a better handle on how to go about changing those behaviors or making next steps to treat the sleep loss. And I also wanted to provide some resources for you guys. So of course, here at UF Health, we do have a sleep disorders center. You must be referred by a physician to go to the sleep disorder center. So the first step here would be, again, consulting your primary care physician. If you do not have a primary care physician, GatorCare has a care coordinator nurse that can help set you up with a PCP. So there are some additional resources out there to help you, even through GatorCare. And then there's lots of education out there, but I wanted to point out a few that are credible and that are reliable that you can turn to. So if you're interested in learning more or looking up a sleep calculator, like I mentioned earlier, I would say going to the CDC's website and the Sleep Foundation are really great places to turn. And then also on our website, we have a different version of this presentation recorded, along with sort of a challenge that goes along with it. So I encourage you guys to explore those resources if you're interested in learning more. And while we were all here, I would love to open it up for any questions you guys might have, or any other discussion that you think might be impactful for the group on this call today.